shampooing in bed. So for the purpose, to stimulate the blood circulation to the soap, and then to distribute the hair oils, provide a health sheen, and then to increase client comfort, and then to assess or monitor hair or the scalp problems. So for the assessment, preparation rather, and then the assessment, assess to determine routinely the use of shampoo products, and then any scalp problems, and then activity tolerance of the client, and then for determine whether a primary care provider order is needed before a shampoo can be given. And then after that, the type of shampoo to be used, and then the best time of day for the shampoo, and then for the planning, assemble the equipment. We have the comb and brush, plastic sheet or pad, and then two bath towels, shampoo basin, wash clothes or pad, and then bath blanket, receptacle for the shampoo water, pitcher of water, and then bath thermometer, and then liquid or cream shampoo, and then hair dryer. And then for the implementation procedure, introduce yourself to your client, verify the client identity, and then explain to your client what you're going to do and why it is necessary and how the client can cooperate. Hello po ma'am, I'm your nurse Arlene for today from Tarlac State University College of Nursing. May I know your name po? Patingin po ng lista niyo ma'am. Kailan po yung birthday niyo ma'am? Ilan taon na po kayo? 9. Kamusta naman po kayo ma'am? I'm fine. And then after that, perform a hand hygiene and observe other appropriate infection control procedures as needed. We have an alcohol here to remove all the microorganisms. And then after that, provide for the client privacy. Close the door, the curtains. And then after that, position and prepare the client appropriately. So, ayusin po natin yung ano niyo, ma'am. Ayos na po kayo. Po, yung ulo niyo po, dapat po naka-steady lang po ganyan. Para po, hindi po mas lalong sumakit yung ulo niyo, gano'n. And then after that is assist the client to side of the bed from which you will work. And then remove pins and ribbons from the hair. Mag-alisin lang po natin yung mga ipit po ninyo. Yan. And then after that is brush the remove the any mats or tangles gradually, and then remove brush and comb the hair of the patient. We have here the brush. And then after that is arrange the equipment. So here's the equipment. They are already arranged. And then after that is put the plastic sheet or pad on the bed under the head of the patient. Lalagay mo po natin. And then after that is remove the pillow from the under the client's head and place it under the shoulder unless there is some underlying condition. And then tack a bath towel around the client's shoulder. That's why, ma'am. And then after that is place the shampoo basin under the head and putting a folded wash clothes or pad before where the client's neck rests on the edge of the basin. If the client is on a stretcher, the neck can be rest on the edge of the sink with the wash cloth as padding. Um, Fan fold to the top bedding down to the waist and then cover the upper part of the client with the bath blanket. And then after that is place the receiving receptacle on the uh, table or chair at the bedside and put spout on the shampoo basin over the receptacle. And then after that, protect the client's eye and ears. And then um, uh, place a damp wash cloth over the client's eyes and then this is it. And then place the cotton on the ear of the client or the patient. And then after that is shampoo the hair. Wet the hair thoroughly with the water. And then after that is apply shampoo to the scalp and make a good lather with a shampoo while massaging the scalp with the pads of your fingers. Tapos na po yung lagay nyo dyan, okay lang na po kayo dun, ma'am. Okay lang po ba yung pagkakamassage ng scalp ninyo? And then after that is rinse the hair briefly and apply shampoo again. And then after that, make a good lather. Make a good lather and massaging the scalp and as before. And then after that is rinse the hair thoroughly this time to remove all the shampoo in her hair. And then after that is squeeze as much as water possible out of the hair with your hands. And then after that, dry the hair thoroughly. and then rub the client's hair and with a heavy towel. And then after that is dry the hair with the dryer and set the temperature at warm. And then um, let's assume that this alcohol is a hair dryer. And then after that is continually move the dryer to prevent burning the client scalp. And then ensure the client comfort. Assist the person confined to bed comfortable position. So, ma'am, pagsilipin natin itong mga to. Mabilang, ma'am. Sige po, ma'am. Gusto pakiramdam niyo, ma'am. Okay naman po kayo. And then after that, arrange the hair using a clean brush and comb. So, client ko na po kayo, ma'am. Ang ganda po ng buhok ni mama. Ayan, na po, ma'am. And then after that is document the shampoo and any assessment. And then for the evaluation, conduct ongoing assessment, and for the problems such as dandruff, alopecia, the pediculosis, scalp lesions, or excessive dryness, or the matting, and then evaluate effectiveness of the medication. So perform a hand hygiene through to remove all the microorganisms. And then, thank you po, ma'am. And then, after that is Record the client findings. Providing special oral care. So for the purpose to maintain the intactness and the health of the lips and tongue and mucous membrane of the mouth, and then to prevent oral infections and to clean and moisten the membranes of the mouth and the lips. And then for the preparation assessment, inspect the lips, gums, oral mucosa, and the tongue for deviation from normal. And then identify the presence of oral problems such as tooth caries, halitosis, gingivitis, the loose or broken teeth. And then for gag reflex when appropriate. And then for the planning, assemble the equipment. We have the towel, curb, basin, disposable, clean gloves, bite block, the toothbrush, cup of tepid water, dentifrice or denture cleaner, the tissue or piece of gauze to remove the dentures, and then mouthwash, rubber tip bulb syringe, and then suction catheter with the suction apparatus if aspiration is concern, and then gauze and the tongue depressor, and then water soluble if lip moisturizer. And then for the implementation procedure, introduce yourself to your client, and then verify the client identity, and then explain to your client what you're going to do and why it is necessary, and how the client can cooperate. So, perform a hand hygiene and observe other appropriate infectious control procedure. We have here an alcohol to remove all the microorganisms. And then, in non-sterile gloves. And then after that is position and prepare the client appropriately. Position the unconscious client in side lying position with the head and bed lowered. And then after that is place the lower under the client chin. And then after that, place the emesis basin under the patient cheek. And then after that is clean the patient teeth. So, clean the patient teeth, moisten toothbrush and apply small amount of toothpaste. And then after that is use a padded tongue bladder or bite block to hold the mouth open. And then after that is brush the teeth holding the breath less as 40-degree angle to the gum line. And then after that is brush the teeth holding, use a short circular motion. And then after that is gently brush the inner and outer surface of the teeth and including the gum. And then after that is the gently brush the, and then after that is brush the beating surface of the back of the teeth holding the toothbrush perpendicular to the teeth and brushing back to the fork. And then after that is brush the patient tongue. And then after that is rinse the patient's mouth and then draw about 10 ml of water or the mouthwash, for example, dilute hydrogen peroxide into a syringe, eject in, it gently into the side of the mouth and then allows the fluid to drain out into the basin and then or sanction as needed. So, and then after that is inspect the oral tissues and then use a foam swab or the moistened gauze square wrap around the tongue blade. And then after that, use a clean swab for each area of the mouth and cheeks to roof of the mouth and suture. And then after that, ensure the client comfort. Remove the basin, dry his face and mouth, applies water-soluble lip moisturizer. And then after that is document the assessment of the teeth, tongue, gums, and the oral mucosa. And then any problems such as sores or the inflammation and swelling of the gums. And then evaluation, consider the client's medical diagnosis and the necessary nursing intervention related to the oral hygiene, and then conduct a ongoing assessment if the appropriate of the oral mucosa, gums, tongues, and the lips, and then report deviation from normal to the primary care provider, and then conduct the appropriate follow-up such as the referral dentist for the caries. And then after that is remove the non-sterile gloves. And then perform a hand hygiene to remove all the microorganisms. And then document the client findings. And then this is the end of the assessing the special oral care.